for the next 10 minutes, I will be discussing our own experience from the community on menstrual hygiene management practices among displaced women in Kerala state of India, which is one of the coastal state, which is one of the southernmost states in India. So as we know, menstrual hygiene is integral for general empowerment and overall well-being of women worldwide. And globally, at least 500 million young girls lack access to proper menstrual hygiene facilities. And the menstrual hygiene management, which is usually defined, as we know, in a way like including three components. One is on the menstrual hygiene management materials, and the other is the privacy of the women, and the third one is the is a satisfied disposal facilities or a hygienic disposal facilities. But the menstrual hygiene management practices in different settings are different in different dimensions in different settings. But some natural calamities or climate change has a different effect on this women's reproductive health at various stages. And as we know, high proportion of displaced women are affected by this, and the challenges faced by these women are different from that of the general condition of women in terms of menstrual hygiene management practices. As far as India is concerned, there are approximately 355 million menstruating women, and many women across the country struggle to maintain good menstrual hygiene practices, mainly because of different reasons. And we have several studies from India which have reported specific menstrual hygiene management practices among the general population, as well as in some vulnerable populations like tribes, like coastal women and all. But limited awareness on the coastal population, especially in the dimension of displacement, is lacking in the scientific literature. So this we have done in a state in Kerala, which is one of the southernmost state, which is known for its advanced demographic as well as epidemiological transition, and which has the health indicators which is comparable to the developed countries. And Kerala is a leader in menstrual hygiene management in India with some initiatives which aim to improve the access to sanitary products and educating women about safe participants. We have 100% literacy of women and men in here. And the state has also implemented the peculiar thing of menstrual leave for female students in some state universities. So we conducted this particular program with a particular study in the state of Kerala. And so with the objective to assess the menstrual hygiene management practice in the context of displacement in a coastal area in Kerala called Chellanam. And we also assess the details of urinary tract infection as well as RTI, and also the cultural and logistic issues faced by women in taking care of their menstrual hygiene practices during the displacement period. And this is the area selection for our study. So this is done in an Ernakulam district, which is almost in the middle of the state, which is a coastal district. This Chellanam Panchayat is also almost coastal, and we have done a multi-stage cluster sampling around 335 coastal women in the reproductive age group. And we have also done this in-depth interviews among these women. So quantitatively, we assess the menstrual practice questionnaire and MPNS 36 for quantitatively assessing the menstrual hygiene management practices. And using the multivariate as well as bivariate analysis, we have analyzed the quantitative results and also the thematic analysis for this in-depth interviews. And this picture, I think it's clear from the picture that so Kerala is there in the coastal, almost coastal state. And also within Kerala, this Chellanam is also in the middle, and it's the coastal panchayat where we have done our survey. And this is some of the pictures of the location of the study. And the profile of our sample women are the currently married around majority around 88%, and half of them are residing in joint families. And as I said, in Kerala, it is 100% literacy is there. Especially, it is known for the higher level of education of women, which is a main component of the higher Human Development Index, as well as other health development indicators in the state. And we have around 41% having college education in our sample, and 59% of them are BPL families, and the occupational dimension is entirely different. Maybe most of them are not working, and some of them are students. And so, in the context of displacement, this Chelanam Panchayat is in this particular district of Ernakulam, which is mostly a coastal village that parallel to the seashore. And this particular village is constantly threatened by flooding, which usually creates so much a problem to the wash facilities, the sanitation systems, and which impacts in the displacement of people, which negatively impacting the menstrual hygiene practices, which is there in the news in most of the newspapers and the other media in that particular period. And it has been this area has been facing this problem from early onwards, mainly from 2017. And this has negatively affected the menstrual hygiene management practice of this particular district of Chelanam. So displacement, we already mean that it refers to the individuals who have to leave their home, mainly in this particular area due to sea invasion, and stayed in temporary shelters for some time or relief camps, or they may be relocated to other areas within their community. And the main results include, so based on that particular scale, we have used more than half of the participants had poor menstrual hygiene practices during displacement. And our results indicated that girls who receive positive education about menstruation before their menarche have a better menstrual hygiene practices. And of course, this education plays a main role. Better educated are having better menstrual hygiene practices. And one of the women whom we have interviewed reported that so during this displacement, when they are in the camp, both usually when this is in the emergency level, then mostly there is no separate space for men and women. Mostly the men and women are residing in the same camp, which usually restricts their privacy to change their menstrual material. Sometimes they will have to wait for at the end of evening, maybe to change the parts, which naturally affect their emotional, mental, and physical health in terms of menstrual hygiene. And these are some of the pictures from the field we have taken. And we also assess the period poverty in terms of financial difficulty they are facing. So 28% reported some financial difficulties, and most of them are using these sustainable menstrual products like menstrual pads or menstrual cups. And the interesting thing we have seen during our field work is that the government initiative, there's a strong initiative from the government and from the non-government organizations in this particular area, which has results in the free distribution of menstrual materials, including menstrual cups. So there are more than 3 or 4 menstrual cups in each of the household when we are visiting in this particular area. And reproductive mobility is another one which is noticeable in terms of we took the self-reported physician-diagnosed UTIs, which was 46%, and nearly three-fourths of them were under treatment. And the RT prevalence was 84%, and majority of them are under treatment. So this poor menstrual hygiene management was significantly higher for those with UTA or with RTA. That's another finding from the study. And those who are affected, I think the main problem is the management of wash facilities. And during sea invasion also, they are facing so much of the problem in terms of these wash facilities and all. And something we have noted is they always, these people are afraid to get UTA and RTA, and there is some uncertainty in getting this UTI and treating this UTI and RTA. And one of our participants reported that so they have been suffering from UTI in the last week. Also, they have admitted. Most of them are admitted in the hospital, or they took some medicine with the prescription from the physicians. And so in terms of displacement dimension, what the positive thing, I don't know whether it's positive or negative, but the adaptability to the displacement is the main learning from our field study, which is supported by some of the reflections on because usually it will take around, sometimes it will take around 2 to 3 days for the camps, or sometimes it is immediately they are arranging, because it's uncertain about the scene patients and all. They will they have managed it in their own way by staying there in the terrace, or they may be transferring to the neighborhood community. The individual themselves have the adaptability of individual level of adaptability is there. And also sometimes the toilets are damaged, and that's also managed by them, where they themselves shift to other villages, mainly because of their own experience for this long years. This is the individual level adaptability which we have seen from the field. And also there are system level, health system level adaptability in terms of the government and the non-government organizations are providing menstrual materials for free of cost. Even menstrual cups are distributed in this particular area. And there are also several awareness classes which was going on, as well as which is already there in the displacement in terms of menstrual hygiene management, in terms of RTAs, and in terms of wash management and everything. And this is from the system level adaptability. And the menstrual hygiene practice needs is basically higher for older women, the poor menstrual hygiene management practices that may be mainly related to their less adaptability to the situation compared to their younger women in that particular area. And of course, the lower educational status is there, is significantly associated with the poor menstrual hygiene practices. Compared to the higher educated women, they have the higher poor menstrual hygiene practices. And the women who are in the below poverty line are more likely to have poor menstrual hygiene practices compared to their APL counterparts. And disposal of menstrual materials is another problem which they have been facing especially during the displacement period. More than 2/3 of the participants were able to dispose their pads in the way they want to when we are asked. But one of our during the interview, one of our ASHA workers in that particular area has reported that after the frequent floods, there are several awareness classes from the government, from the NGOs, that movements are positive impact in that particular area. But prior to these classes, these menstrual the pads were found floating everywhere during the floods. So many pictures are coming in the media regarding this particular one and evidencing this cotting. So the main strength we have noted is that it's possible that some participants didn't accurately report their infections, but there are not much studies which study this menstrual hygiene management practices in the context of displacement. And we have used a standard questionnaire and randomly selected wards. And the results obtained from this study is based on the self-reports that may have some limitations. And reporting, but for UT and RT, we have verified it with the physician reports. And reporting bias may be there regarding the infections and treatment. And while generalizing the finding, I think additionally the results obtained from this study are specific to the demographic as well as cultural context of this Chelanam Panchayat, and maybe only applicable to similar settings. And there is also limitation of recall bias. And the conclusions mainly we have the main learnings from this particular one is the difficulty in the disposal of menstrual materials, which is everywhere, but during the displacement also they find it very difficult to manage the disposal of these menstrual materials. And the study findings highlight the need to focus on wash facilities. So somehow because of this, because of the programs from the government and NGOs in the state, they have managed the menstrual materials, affordability of the menstrual materials well, but the wash facilities are very much damaged in that particular field during this displacement. So there is a need to develop context-specific, sustainable and adaptable programs for improving menstrual hygiene management situations for women in this emergency context. And regarding the high level of UTI and RTA reported in the state is also need to be studied with clinical findings. So this is based on the self-reports. So for the future studies, we will definitely concentrate on the UTIs and RTs in a clinical way. And so our learning mainly underscored the importance of ensuring adequate attention which is needed to pay to menstrual hygiene management practices in similar to women in the similar situations. Here you can see the picture in the women are women in Chelanam protest against the sometimes it's called the Jalasadabdi for building the sea wall. So the women are very empowered, very aware, but they cannot manage the wash facilities during the displacement period. And some of our other vessels regarding this particular period poverty from this particular state indicated that Kerala is one of the states in India with the highest coverage of hygienic method of menstrual protection, with a narrow rural-urban gap in the state. And the state is non-metropolitan, and where the rural-urban distribution of the population, healthcare facilities, and education infrastructure is mostly least skewed. And this success, this is limited empirical evidence on menstrual hygiene practices and period poverty in the state, which needs further evaluation in the context of this displacement and all. Thank you for your patience and thank you for your time.